So, I'm ready. My name is Teresa Mitchell. 5 years ago, I had a hysterectomy, and at the same time, I was implanted with a stress urine incontinence device known as mesh. I did not know this was an untested toxic piece of plastic. I did not know that it was made from the byproducts that was left when you made petrol, from the rubbish that's left over after petrol. I did not know that it was a permanent implant. I did not know that it had the possibility to grind its way through my vagina, my urethra, into my bowels. I've lost 30 kilograms of weight since I had this procedure. 2 weeks' time, nearly 5 years ago. I was on a cocktail of opiates and narcotics from the doctors, 10 or so, I believe. Atriptyline, nortriptyline, tramadol, some pain patches that left chemical burns on my body. This is after I spent time telling me it was all in my head. My life has been destroyed. When they gave me methadone for my pain, I said, that's what you give junkies, and then I turned to using cannabis. Cannabis has given me back a quality of life that I simply do not have. I use a walker most days. I'm struggling because I'm on a stick today. My mobility is like a 90-year-old. I have no life. I've worked 1 day in 5 years since I had this device put into my body. I have been in pain for 5 years. From the moment I wake up to when I go to sleep, I'm in pain. And the drugs that the doctors gave me left me like a zombie. I was a medicated cabbage. I couldn't even make a cup of coffee without forgetting something. Cannabis gives me a quality of life. It means I can actually do the few things I still can manage by myself. I should have a caregiver. I've been disabled by a MedSafe approved product, a government product, and no one has been held accountable. No one. And I have written, and I have asked, and I have begged, and I have pleaded for help from Parliament with my condition. I can't go anywhere now to get treatment for this condition, because I got busted with having cannabis because I refused to sell some. So they went and narked on me. And because I had 6 months supply, that was deemed to be possession for supply. So my life has been destroyed. I am now a convicted drug dealer. I was forced into a guilty plea because I bled too much. I am now in pain for the rest of my life, and no one wants to take accountability. I think it's immoral that soon, when the euthanasia bill comes in, that I can go and have myself put down. That's immoral. But I'm a criminal because I want to use a plant and not take opiates and narcotics or anything that the doctors can give me. I was a minister, a lay minister, for 15 years, and I got fired after I reported somebody. I went to become a security guard. I was looking after the All Blacks and the Breakers. I am not a person of dodgy intent, but because I had to make a choice between something legal and illegal to have a kind of life where I could do something, I am now a criminal. And that's not acceptable. And then they sit there and say that we can get certificates or things like that. I have worked in 5 years. I have a husband. I'm not entitled to anything. ACC refuses to talk to me. ACC refuses to cover this removal surgery. They sit there and tell me I have to go back to the same surgeons that did this to me in the first place, and I've already had 6 goes, and I refuse to let them do it again. I would like to have the opportunity to be able to grow my own cannabis so I know what goes into it. I grow all my food that I eat as much as I possibly can, and that way I can afford it. I cannot afford the prohibitive cost, and I think it's disgusting that we're in a position like this where a MedSafe approved product, i.e. a government product, has left me disabled, and now another government department has turned me into a criminal because of the disability that the previous government department did to me. There needs to be some action happening on this, and it does not seem right to me that now I can go and have myself put down. And the pain's too bad because I'm at that point now, because I struggle to stay alive. I struggle every day to find a reason to stay alive. I go to bed at night hoping I don't wake up so I don't have to have this pain anymore. And the doctor's drugs, All they do, they'll kill my brain synapses, they'll cause me death, they'll give me heart attacks, they're severely addictive. I mean, there's an opiate crisis going on. And are you, as our elected representatives in this country, you have a responsibility to do something. Because it is a government product that has left me in this position where I am exactly now. And that is why I think that our laws need to be changed so that there are people like myself who are chemical sensitive, who cannot tolerate drugs, who can't tolerate anything whatsoever, have a choice, and we're not being called criminals. I get asked if I'm a crack addict because I've lost so much weight. The pain is eating me, literally eating me alive. And I really do not appreciate now having a stigma of being a convicted criminal because I chose to do something that was illegal because it's the only thing that has given me any kind of relief in 5 years since I had this done to me. Thank you.
Thank you. Thank you very much. Where do you live?
I live in Pocono, and I am only here today because a complete stranger funded my airfares, my motels and my taxis, so I could speak. And I've met you before, Louisa, because I used to be in the
Your ACC issues, have you fully explored advocacy?
The last time I spoke to my current caseworker, she basically told me that she was going to end the phone call because I refused to fill in another form that I'd just done, and she had to make an internal phone call to get the information she required. I suffer from PTSD. I'm recovering from a bit of a nervous breakdown at the moment. I can't open emails, I just can't do anything. And I have no help.
Have we got yeah, we might refer you to the MD from where you are.
Tim Vandermeer is like this amazing, that, I mean, I've had a run around from Winds. I was, I'm not
Well,
sure.
if you don't mind, we may, I'm going to ask you to follow up because we want to make sure that you're getting entitled to. So you can
ACC would not even pay for me to fly down to Wellington to see Hanifa Kauia, who is the only surgeon in this country that has anything close to expertise, so I'm not left in a wheelchair or with bags. Thank you.
Okay, next to Richard,